COVID hospitalizations and deaths are trending down, but the debate over masks remains front and center.
In the last week, 11 states, including Wisconsin, have announced they are rolling back mask mandates.
And the Dane County mask order is set to expire on March 1st. UW Health Chief Quality Officer Dr. Jeff Pothof is back with us again, as he is every Tuesday. Welcome.
Hi, Dr. Pothof. Good to see you.
Yeah, good to see both of you.
Do you think that is the right decision at this point to end the mask mandate in Dane County?
You know, it feels weird to say it, but based on current trends and data, it probably is okay to remove the mask mandate come March in this area, given the significant decrease in cases, the lessening of COVID-19 in our community.
A lot of school districts have not told us yet what they intend to do about this. Children under 5 are still not eligible to be vaccinated. But if starting March 1st, masks are no longer required in indoor settings, what is the point in having students wear masks in schools?
Yeah, I think this is a great question. And, you know, some of the same factors come into play. So we want to see decreased cases in order to take masks off in school. We want to see that positive test rate be lower. But the other variable that plays into that is the vaccination rate for that group that you're going to cohort together and unmask. And in Dane County, the high school students, that kind of age group seems to be vaccinated at a pretty high rate. But those 5 to 12-year-olds, our vaccination rate isn't very good there. So that does increase the chance that they could be a nidus for transmitting the infection. I think that's one of the variables that school districts will have to look at as they think about pulling back mask mandates for the schools, which may be okay, is what's that vaccination rate in that younger population? And is it high enough where we feel comfortable pulling back the mask mandate?
And Pfizer sort of pulled back that recommendation, that research for the younger kids right now.
Yeah, I think that's kind of confusing. You know, back in December, Pfizer said, hey, we reduced the dose by tenfold. We gave 2 doses. We didn't see the efficacy that we wanted. We're going to do a 3rd dose. In January, when Omicron was raging, the FDA said, hey, let's see your data. Maybe, you know, something's better than nothing. And I think they saw that data and said, yeah, let's just wait for 3 doses, which will likely come by in April. I think the drop in Omicron cases helped them say, you know what, the urgency behind this has dropped just a little bit too.
A lot of recent polling has showed that parents are increasingly pro-vaccine, but less convinced about masks. So how do parents weigh the concern of their child getting COVID versus the educational or emotional loss that some kids are experiencing being masked?
Yeah, I think it's tricky. I think, you know, masks are something you see on someone's face. You know, us as adults, you know, it's not something that we would like to do. I think largely kids are much more tolerant of the masks than we are as adults. We know we've got data that says, you know, the ability for kids to detect emotion and things like that isn't significantly impaired with the mask wearing. But, you know, I think the vaccine is a whole lot easier. You go, you get your shot, you've got great protection. In long term, that is the right strategy. Get vaccinated so that we don't need to wear masks. So there's something to be said for how they're feeling.
For adults, is a 4th booster in the offing?
You know, I think at some point we're going to need another booster. I think a lot of folks are looking at a recent CDC study that suggests that boosters wane after 3-4 months. And in that huge group of people that they looked at, they did. But what they couldn't tell with that study is who are those people? Are they older? Are they immunocompromised? I'd say looking at our data in the health system, it's not everyone has decreasing efficacy at that 3 to 4 month period. It's those folks who are immunocompromised, are elderly, have comorbid conditions. They tend to be the ones who, despite being boosted, sometimes end up in the hospital.
And people see the masks coming off on March 1st. We're out of the woods. It's over. No.
Yeah, I think we're getting closer. I hope we get endemic. There's always that little thing in the back of my mind is like, you know, I really hope there's not another variant around the corner that takes us for a loop. I don't think anyone wants to do that right now.
Absolutely.
Well, yeah.
Doctor, thanks for being with us as usual. See you next week.
Great to see you, Dr. Pothof. We appreciate your time.